Hi, I'm Vishal Kishore, and I'm the Director of the Health Transformation Lab and Professor of Innovation and Public Policy at RMIT. Now, here at the lab, we aim to provocatively and rebelliously transform healthcare, playing with breakthrough technology, innovative and wacky ideas, and the most inspired and interesting people. My own interests lie in healthcare cybernetics, political economy, and the ethics and public policy of healthcare systems. But if you think that's interesting, just wait until you meet the rest of the team.
My name's Matiu. I'm the Deputy Director of the Health Transformation Lab. I'm both a clinician and a designer, and I've worked in healthcare for over 27 years here in Australia and internationally.
I'm Juan Sanin. I'm lecturer in the School of Design and fellow in the Health Transformation Lab. I work creating living labs for social innovation in healthcare organizations.
Hi, I'm Charlotte Flegner and I'm an Innovation Fellow at the Health Transformation Lab. I bring my background as an architect and also in design anthropology to the lab's strategic design and innovation work.
Hi, my name's Jess Chatterton and I'm an Impact Fellow here at the lab. My background is in biomedical research as an immunologist at the Doherty Institute. My interests are sustainability, systems thinking, and science communication.
Hi, my name is Nicolas. I'm a development economist originally from Argentina. I work as an Impact Fellow researching issues in the intersection of economics, public policy, innovation, and political philosophy.
Hi there, my name is Govind. I am an Impact Fellow here at the lab. My background is in data science, and my interests lie in the different ways we can facilitate human flourishing and cybernetics and its feedback loops.
So I wanted to start by asking Juan what interesting changes he had noticed from a design perspective.
Hi everyone, thanks. Yes, I think that there are many interesting things happening when it comes to design. I think that probably one of the most interesting things is the response of the maker movement to the crisis that some hospitals have been experiencing since the early stages of the coronavirus in terms of protective equipment.
Right, so you're talking about like the rush of the DIY projects that we've seen really take over the media lately?
Yes, exactly about that. And I think that what we've seen is that like in the lack and scarcity of protective equipment and clinical equipment in general has motivated almost anyone with a 3D printer and some prototyping equipment at home to come up with their own solutions. I wanted to share something, but I think that Vinisha would have to. Okay, yes, and I think that a really good place to have a like. So what is happening is Make magazine. So for anyone who doesn't know what Make magazine is, this is a platform that initially it was a magazine. Now it's just basically like a website and an online magazine. And since 2005, when it was created, this magazine has become a platform where around the world share their projects. And since early March, we've seen all kinds of projects being shared in the platform. So I think that everyone saw these 3D printed valves made in Italy early in March, and nowadays, like if you go on the website, you'll see like all type of things like instructions to fold a bandana and make a face mask, 3D print a face mask at home, and then things that are like more like very complicated and sophisticated equipment like sterilizers or ventilators. I think that this is interesting, but it's at the same time problematic. So on the one hand, I think that it's a nice expression of not just creativity, but also solidarity. So people are putting these equipments like to the service of, let's say, like humanity.
Right.
But we have to take into account that many of these projects in this magazine, for example, are very naive and can be like dangerous and very problematic.
Okay, so yeah, although like the idea of trying to help is really wonderful, and we love that people have taken the opportunity with more time on their hands to get involved. As you mentioned, there are some issues with the DIY approach.
Yeah. Yes, I think that the issue, I really like how our friend and colleague Charlotte put this on Twitter a couple of weeks ago. The problem is that healthcare equipment is not a craft project, and many of these projects are just that, craft, made by people who are not experts in health and are not experts in technology. And many of these masks and ventilators have been flagged as risky by many different health organizations. But anyhow, I think that the Maker response to the crisis shows that in the future, the production of health equipment can be decentralized and somehow democratized.
Totally, yeah. So how do we approach these ideas and help to manage DIY participation in a positive way, do you think?
Yes, I think that what all this crisis and the response of the Maker movement is showing is that partnerships between industry and university are going to be crucial for the future of healthcare equipment. And I think that we have a really good example at RMIT. And so this is a simple, these are protective face masks that were created in the School of Fashion and Textile. And we have here a group of designers led by Dr. Scott Mason in collaboration with industry partners. Is a project that also involves not necessarily like clinical students or students doing medicine, but students from like fashion and textiles. And I think that these partnerships show us where the future of protective equipment could go in the near future.
Yeah, that's awesome one. I love hearing about RMIT getting involved. So we've had a bit of insight now into the homemade side of healthcare. What about the technological side? We've also seen a really rapid uptake of a lot of new technologies designed for connecting people, telehealth apps, Zoom conferencing, etc. But I think we've all noticed, subconsciously at least, that meeting via video, like we are here today, isn't quite the same as meeting in person for a range of reasons. And I think Gobind actually has a few thoughts on this that I'd really love to hear. Gobind, a lot of new models of healthcare have come into play. What's your take on this?
Hi, Jess. Hi, everyone else. So with regards to new models of care, they aren't actually really new models of care, but these models of care, such as telehealth, have been around for quite some time now. What's happened because of COVID-19 is that they've actually finally gone mainstream after years of debate. And while researching telehealth, I found out that the first known telehealth consult in Australia happened in 1874 through Morse code. And it happened in 1874, but it took a pandemic in 2020 when information and communication technologies have shot through the roof. It took a pandemic for it to finally become mainstream. And what we have to realize is that since 1874, lots of other technologies have come into play, and that telehealth is just one step towards different healthcare utopia that we have in mind.
Right. So I've heard a lot of people talking about virtual care as well. Can you tell me, is telehealth the same as virtual care, or is that something entirely different?
It's kind of same. Well, it's different, but telehealth is one of the tools in the arsenal of virtual care.
Right.
We have to recognize that telehealth is only the first step. And while telehealth is all well and good, it isn't the whole full horizon of possible care. There are a whole host of other technologies that have come into play, such as remote monitoring, home care sensors. We all have smartphones, and all of these smartphones are connected to servers and data crunching supercomputers. We have chatbots, we have AI that are powering the chatbots. Sometimes we don't even know we're talking to a computer anymore.
totally.
Yeah,
So,
but none of them have actually passed the Truman test yet.
yeah, so I guess, so we have our current healthcare model, which is often based through in-person care, and then we have a lot of new models of virtual care. So are there examples of where virtual care can be utilised in addition to our current services in the future that you see coming into play?
Yeah, totally. So one thing about virtual care we have to keep in mind is that virtual care does not mean diminished healthcare. It aims to fill in all the gaps where the current healthcare models lack.
Yeah, okay.
And I'll give you a scenario of a possible future. It's let's say I have a wearable that tracks my heart rate and how my heart is doing and my blood pressure and everything else. And alongside this, I have a host of sensors in my house that track my daily movements and what time I do when. And so let's say there's an anomaly in my heart rate, and based on aggregated data, it shows that there's a small chance that I may get a heart attack soon. But this is just a small chance, and it's not for certain as yet. So what could possibly happen is that data could feed into an algorithm together with the home sensors. It checks if there's a correlation, and then the system then pings my physician, my clinician, and then makes an appointment for me. And together, this is investigated.
Right. And so I guess there's a lot of potential there, but also I think I've heard you talk about how a lot of the data around our health currently through wearables and through the technology we use is quite disaggregated. And so I don't know, Juan, if you have ideas about this too, how we can integrate the new virtual care models with a lot of the wearable technology that's coming out to create a new model of healthcare?
Yeah, I really don't have ideas, but I do imagine a future where, for example, your smartwatch is connected to the system your GP has, and somehow you are able to report back on your GP automatically using your wearable device or anything, or a future where we saw that, for example, at this moment, Siri is able to help people to get some help if they have some symptoms of coronavirus. Maybe in the future, telehealth could be integrated with these voice assistants, and then we could talk to voice assistants asking for, I don't know, like clinical advice, things like that. And I think that drones and like Australia Post could also play an important role delivering medicines, prescriptions, these sort of things. So I think that integration of telehealth with other technologies is going to be like something that we'll see in the future.
Yeah, awesome. Gobin, did you have any other ideas on that before we just wrap up?
Yeah, if we look at who in the industry currently is making lots of really engaging digital experiences, it's the gaming industry at the moment. Right. And what's also interesting is that the gaming industry is leading the market into the next version of the internet. And if we can draw from how they're doing that into how we engage and change virtual care, we might be able to learn from them and augment how healthcare is done.
Yeah, cool. All right. Thank you so much, Gobind and Juan, for your insights. I know here at the lab we're working on a few applied projects along these lines, as well as continuing our research into these ideas that have really been floating on the fringes of society, and they've really only now come to the fore. So up next we have Matiu Bush, Deputy Director of the lab, who has worked in palliative care and began a project that designed towards better deaths in aged care. So DX, also known as death design, is an emerging field of exploration for experience and service designers. And Matiu is going to explore the world of DX with RMIT lecturer Emma Luke. Thanks.
Fantastic. Welcome, Emma. You're an associate lecturer in the School of Industrial Design. I'm really keen to understand when you started to explore the role of designers and that role that they can play in producing better deaths and better death experiences, both for the person dying but also for their family members.
Hi everybody, thank you very much for having me. So look, this has been a really interesting experience. Matiu invited me in to sort of talk about this area and run a studio in the industrial design program, the Masters of Industrial Design and Technology program at the start of the year. Little did we know that we would be stepping into this space and our students would be basically going through a autoethnography experience of actually really having to engage with and think about these ideas. So obviously the idea of dying alone in isolation is something that's a core terrifying prospect for anybody. So to be living through this situation and then having to actually contemplate their role as a designer and how designers can sort of look at these situations going forward, I think it's actually really brought to the fore the fact that many of these things were not necessarily sort of thought about until families had to think about them, and all of a sudden there's been this rapid transition into a space where it's been sort of really terrifying for everybody. So I guess from a design perspective, really looking at how we holistically and empathetically sort of bring the tools of design into this space and think about the psychology of the situations and the spaces. It's been very interesting to see sort of responded to this situation, and they've actually been really incredible. I was a little bit worried that it might be a bit too full on at first, but they've actually found going through the process and employing their sort of user-centered design sort of mentalities has actually been kind of quite cathartic in the middle of all of this. So yeah, it's really sort of bringing in a user-centered design mentality, thinking about things like emotionally durable design, aesthetic sustainability, how we deal with the senses, beauty, the things that are really intrinsic and really important at a deep sort of philosophical and human level, and then how you might sort of look at ways that we project into the future. So we've been very fortunate in that spoken to an amazing academic, Pia Interlandi from the fashion school at RMIT. He's actually a trained mortician. She's actually doing projects for people in the middle of this space at the moment, where family members are, you know, deeply traumatized because they can't be with family when they're passing away. They can't, you know, go into aged care facilities irrespective of the COVID situation. So looking at how do we connect people physically? How do we sort of do things like she's doing hand casts for people. And then we've also been talking to Brigitte Engler, who's a really amazing futurist, who'll be sort of giving some of her perspective on where this stuff is heading in the next couple of weeks.
Got you. Just a question, Emma. What challenge did you give the students to start their design exploration in regards to death and dying in a time of COVID?
So yeah, we basically sort of started out by going, okay, so what does a positive end of life experience look like? How will we actually sort of go about employing a sort of user-centered design approach to that? And then how do things like thanatosensitive design and hallucinogenics sort of come into play? And if we were to basically take a positive design approach, which sort of it sort of takes from the ideas of positive psychology and basically reframe our perspective, and then use that as a framework to step into the design space, how could we then sort of look at reframing these quite traumatizing, quite scary kind of possibilities, and then look at what design interventions might be like in a digital and a physical and a hospital orientated sort of context.
Death is often occurring in clinical spaces, and there's a lot of clinician-driven decision-making in regards to dying. I wonder if we're reaching a peak death literacy in the community because we're confronted with it so often. So talk us through what the students produced as part of their experience. What were some of the outputs?
So we've got 5 really interesting projects that are sort of developing at the moment. So there's been a lot of research and consideration about basically what private, shared, collective and distributed grief and processing sort of looks like, and how the digital is actually sort of coming to play in that space. So the projects that we have, one of them is basically a large-scale digital memorial space, which is a hybrid space which would potentially, you might have sort of a large space somewhere like Melbourne, but whether you could have distributed satellite spaces in smaller communities internationally, where you would be able to basically go in with a key, and it would actually bring up a digital asset, which was a combination of video, voice material, potentially access to particular memorial sort of space that could be actually sort of engaged with as a place of sort of contemplation and grieving for somebody that has sort of been touched by this situation. Another project was sort of looking at end of life in isolation for dementia patients. So, you know, obviously somebody whose faculties have obviously already been significantly impacted, that they might not necessarily know what's going on or understand why their family members are not coming to see them or their routine has changed. So these guys have sort of looked at how, okay, so could you potentially have some sort of a haptic wearable that, you know, could emulate the feeling of a family member holding your hand or touching your arm, and whether there would be, you know, so a device that the family member could basically kind of touch, and that sort of imprint and impression could somehow give a sense of comfort to that person, and yeah, what that kind of isolated touch might potentially feel like. There's an interesting project I saw last year in Slovakia at the Sensorium Lab, which was it was called an intimate earthquake suit. So basically they had got the mapping of these actual seismic encounters from a particular location, and these were man-made earthquakes from fracking, and they basically were able to simulate them in a suit that you wore, and you basically went through an experience of this space, and you actually felt the tremors, felt how people felt going through this experience. And I think those sorts of examples lend themselves to an interesting idea of what the opportunities are for haptic wearables in the future, and how we can actually have individualized, personalized experiences for people where they are potentially sort of remote and isolated from loved ones.
It certainly was the case with COVID and the inability to visit loved ones. Now, it's brave to design in these spaces, and it's even braver to be a lecturer taking students through, especially because you had a significant amount of international students. So how did you help them navigate death and doing a project on death during COVID, when they themselves are isolated and potentially worried about their own home countries?
Well, yeah, we had a big chat about this, because I was, yeah, obviously very worried about how everybody might be feeling being isolated. And yeah, they're sort of, they've kind of really sort of come together in the teams that they're working on these projects together. So they've really sort of used a co-design process, I think, in quite a cathartic kind of method. And to an extent, it has been an ethnographic sort of process for all of us, because we're all sort of far flung all over the place. We have a couple of students in China, students all over the place in Australia. And so actually coming together and sort of having a group to be kind of working on these projects in a collective fashion using things like Miro and stuff like that online. But yeah, I guess sort of really kind of talking through and yeah, processing how, you know, how do you design in the midst of, in a remote fashion, in the midst of a unfolding situation is extraordinary. Some of the Chinese students are actually doing a project looking at sustainable funeral processes in China. So they're sort of looking at Beijing, and they've just got some extraordinary stories coming out about how quickly people are being cremated and then having to be sort of moved on because of the gravity of the situation. And for them, you know, obviously kind of going through the process of understanding how, you know, how end of life and funerals are normally dealt with, you know, there's a lot of kind of ritual and tradition and important symbolic aspects which have all been thrown out the window to deal with this situation. So how do you potentially make a shift and think from a thanatosensitive perspective, which is, you know, how we can bring the digital into this space and somehow bring to people assemblages of these physically meaningful and healing processes and methods that they've sort of been used to historically. I guess the big thing kind of coming out of this is, you know, and a lot of the sort of projections that I've read, I'm interested to see what the futurist has to say next week, but they're sort of saying that we are going to have to fundamentally change the way that we are in terms of physical distancing and other things going forward. So what does that mean for these sorts of important milestones and you know, sort of ritual events like funerals. It's a large thing to consider.
Fantastic. Look, thank you so much for sharing that with us. It definitely shows that there is a role for designers in designing better deaths and better death experiences at scale. Thank you so much.
Thanks for having me, guys.
Pleasure. MediStays is the go-to website for patients, families and carers needing accommodation near Australian hospitals. Up next is MediStays co-founder, Associate Professor Sarah Everett. She, with the Health Transformation Lab, led a project that united patients, families and health workers who needed to self-isolate with dedicated discounted self-isolation accommodation using the hotel industry. It was a breakthrough project. Sarah is joined by RMIT's Rachel Wells, who is a journalist and a storyteller, and Director Vishal Kishore.
Thanks, Matiu. Thanks for joining us, Sarah. As Matiu mentioned, you teamed up with the Health Transformation Lab really early on in the pandemic, or really early on in the pandemic as it reached Australia's shores. Tell us a little bit about, I guess, how MediStays came about in the first place, and then how the pivot to come on board and start providing self-isolation accommodation came about.
Thanks, Rachel. Great to be here. So MediStays was really founded to break down the barriers for people in our regional and rural communities needing to travel for medical care. There's around 7 million Australians living in those communities, and if you consider that when they need to travel for specialist care, they usually need accommodation near the hospitals. And unfortunately, many of them were relying on accommodation websites, which, as you know, are targeting people going on holidays or corporate business trips. So they don't necessarily provide the relevant information needed by patients and carers, the financial support or the accessibility information for the property. So that's been our core focus when COVID-19 occurred, because there was such a shift in referral patterns and procedures happening in hospitals. That impacted us greatly because nobody was travelling for all of the procedures, elective procedures and surgeries, follow-up appointments and things were either changed to telehealth, which is absolutely brilliant for people living in the country, and for those needing surgeries and so on, it has been postponed. And so straight away, incredible timing that we only just launched our website with integration into the properties in February. So within a couple of weeks, we were faced with this, huge change. And what that did was some of the ideas, much bigger picture, long-term vision for MediStays. Suddenly we did a pivot and have been able to support many more people needing different types of accommodation. So it was really brilliant to come on board with the lab at that time and to promote our partnership and the work that we've been doing, and to support different people. For example, as Emma mentioned before, people can no longer be admitted into aged care facilities. And for many people in rehabilitation and younger people with disabilities, that was the go-to. So we've been able to come on board, accommodate them in our fully accessible accommodation, meal deliveries, groceries, all sorts of things around the country, which has been really brilliant. And I think from a personal perspective, so wonderful for these individuals because they're now living with their loved ones, their partners, and so on. Likewise, in end of life, again, being out of the clinic and into an environment and a private space to self-isolate with their families has been really important. Across the country, there's patient lodges, Cancer Council lodges, for example, Ronald McDonald House, that have provided this incredible living space for country families. But of course, again, they've needed to self-isolate. So we've taken on board accommodation for those people across Australia. So that's been more of a shift of providing them with alternative accommodation. And then for people from a hospital perspective, MediStays has provided them with a very efficient and reliable service because when the push early on and a couple of weeks ago was to free up beds, get rid of bed block, get people out of the hospital into a safe place, we've also been able to accommodate those people safely near the hospital if they're not yet ready to go home, but they need to stay nearby and have check-ins and so on. Again, integrating so much of what has been discussed this afternoon, integrating the technology, telehealth, monitoring, all of those things, but in a private setting.
Great, Sarah. And can you just tell us a little bit about how important it was, I guess, to team up with the Health Transformation Lab early on in that process in terms of being able to respond quickly and scale up your response to COVID-19? And I guess tell us a little bit about how this pandemic has kind of transformed your business model.
Sure. So when we launched the site, we had around 80 accommodation partners either live on the site or onboarding at that process. And when we partnered up with the lab, really exciting opportunity to promote the work that we've done. Vishal and I spoke on several media sources, Channel 10 News, ABC Radio, and this just generated such a buzz for the accommodation industry, which was hit so hard. Suddenly, just hundreds of properties, probably thousands across the country, and tens of thousands of beds were empty. So with the technology that we have, we integrate the availability and the rates. And through that partnership with the lab, we could work with that. We received literally hundreds and hundreds of partnership inquiries from properties around the country. And then we've started a really rapid onboarding process for those properties to support more patients, families, and also staff. So the time frame, and we're still working on this, we have hundreds more to go, but the time frame for this is probably something in a normal environment that we would have expected to maybe achieve by the end of the year, and instead that's just been condensed into the space of a couple of weeks. So amazing impact for us longer term to be part of that partnership.
Great, thanks, Sarah. And I might just jump over to Vishal just very quickly as well. And I think Sarah just made a really good point then about how responding to a crisis, I guess, allowed her to do quite enormous things with her business model in a very short space of time. I mean, what would you say about this collaboration, Vishal, in terms of, this intervention, I guess, came at a time when the health experts were really concerned about the prospect of this pandemic overwhelming our health system here in Australia. Thankfully, we've seen some really great results in terms of flattening the curve, but when you and Sarah came together, that was certainly not the case, and you were able to come out with a very important intervention very quickly.
I think all. Can you? Yeah, great. You can hear me. I think. It was one of the, exactly as you say, Rach, in that particular moment, what were we really worried about? We were really worried that demand was just going to swamp our system. At that stage, we had no flattening of the curve. We didn't know what it meant. Experts kind of had views, but actually even the expert views about what the stress was in the system, how extreme the stress was going to be on the system, when it was going to hit, how it was going to hit, how bad it was going to be. All of these things were uncertain. And I think what's brilliant about Sarah's model is that it essentially finds ways to increase capacity in the health system rapidly. So it means that all of a sudden the health system's ability to cope with demand has just increased several times in really interesting ways. And the fact that Sarah has been isolating, like Sarah and her venture and partners have been able to help people to isolate, particularly immunocompromised people, for a while now. And so they knew how to do it. They knew how to clean things. They knew how to help to isolate. They knew how to support people. They knew when and where and how telehealth would work to support all of those things. So it was just a really brilliant example of quickly finding capacity in and around the health system to deal with an uncertain future. the fact that Sarah and her co-founders are just absolutely brilliant and lovely people was just excellent as well. They were doing it for every reason you could ever want an intervention like this to happen. You know, they were doing it for human beings, for people, for patients, for carers. They were motivated by all of the best things about our health system and our care system. So to find somebody who wanted to run into the breach of this crisis, but also motivated by all those good things, it was great for us to be able to play in that kind of thing and to be able to support, and we hope to add some value.
And Vishal, just quickly, I guess one of the things we haven't touched on in all of this, and I know something you talk about a lot in this, is that this is not just a health crisis, it's having major impacts on our economy and our society. And I guess this intervention was helping to solve more than just one problem here, wasn't it, in terms of the impact this was having on the hotel industry as well. Can you just talk us through that a little bit as well?
You're totally right, Rach. Absolutely. So as we do say, this virus has done all kinds of interesting things for us, quite apart from the health impact. It's brought back or revivified the idea of society and community in a kind of a special and interesting way. It's also it's running havoc through our economy as well. So whether it's unprecedented drop-offs in flight bookings, entire businesses having to shut down, sectors in distress, share markets being collapsing, casual workforces disappearing with the stroke of a pen. What's so interesting about this intervention and its particular importance right now in the context of the pandemic is that it had a one-to-many problem-solution relationship. So it was solving more than one problem at the same time. It was solving the problem of capacity in the health system. It was solving the problem of nobody booking in for hotel stays, and so empty hotels. Which doesn't just mean a bunch of hoteliers are not making as much money. It means entire workforces have nothing to do and they are in jeopardy. So think of all of the people who work the hotel, the front desk. Think about all the people who are servicing the room. Think about those people who are in the kitchens and the galleys preparing the food. All of those workforces are thrown into disarray by people not staying in hotels. So in a sense, this was solving so many problems at the same time. And it was just, it's exactly the kind of socially innovative idea that I think these kinds of situations pull out, and that we should try to find ways to hardwire into our economy and our society.
I know we are running out of time, but Sarah, I do want to put that same question to you, because I imagine you're getting direct feedback both from patients, hospital workers and the hotel industry. Can you just talk us through quickly what the hotel industry as well has responded to this intervention?
Yeah, sure, Rachel. Such an important question. Our partners have come on board, so from very large portfolios of properties across the country to very small independently run properties. And those accommodation providers have just been unbelievable in their approach to support people. They're doing it so tough. We've never seen vacancy rates like this, or rates, in fact. MediStay's rates are always discounted off the public rate that is available. And at the moment, those rates are just so low. I mean, on behalf of the patients, wouldn't it be wonderful if they could actually obtain those rates year round, but they're just not viable. They're literally staying at cost price. So the properties have really come on board. We require an immediate investment from them, because the information we require is very different to an Expedia or a Booking.com. We don't need to know about their swimming pool. We need to know about their accessible showers, for example. So they've really had to come on board and provide very detailed information, because when we refer a guest to them, we need to ensure that that information is correct. And we're in it for a very long-term partnership with them. So they have adapted very quickly. They've been extremely responsive. And as an organisation, we've been incredibly fortunate that some of these extremely talented people from the accommodation industry have actually joined our team. now. So that's probably been for us one of the greatest outcomes of this, that we've got the passion and the expertise from that side of the industry to complement our backgrounds in health as well.
Wonderful. Rachel, Sarah, thank you both so much for the conversation. Sarah, additionally, thank you so much for all of the amazing work that you're doing out there in the sector. As I said, to be partnered up with socially innovative and socially enterprising organizations like yours is just kind of an unbelievable privilege and opportunity. So thanks for all of your great work towards this. And Rach, thanks for the conversation.
Thanks so much. Thank you. Really appreciate it.
So friends, we have, I believe we have a question with the last few minutes that we have remaining. Venetia.
Hi, yes, we have one question. It's for Matiu and Emma, I think, but anyone feel free to jump in. What shifts in technology rituals from the pandemic can be seen as continuing collaborations in the future, focusing upon the aged care and end-of-life designs?
Certainly, we have seen a significant amount of iPads being donated to aged care facilities to increase video calls. At some point, an ICU doctor reached out to the lab asking for advice because they could not, the Wi-Fi in the hospital was not strong enough to manage the iPads. So we suggested to them using baby monitors in order to, that didn't have to use the internet, so that loved ones could communicate with their COVID positive family members. So the person with COVID could communicate with the family members. We found a way around some of the technological problems with equipment that already existed for other purposes, such as baby monitors and baby video devices. Emma, what other sort of technologies have you seen? We've seen a lot of the ability to record people's histories and then activate them with QR codes on urns, on grave sites. Emma, anything from your perspective?
So, I mean, I think a big thing sort of is really thinking about ambient technological interventions that have a really powerful sort of personalization element to them. So, you know, being able to use something like a fingerprint to enact some material information. I was talking before about things like, you know, a hand casting. How can we actually sort of take physical material sort of artifacts, but then embed them with digital sort of memories and the ability to basically sort of tap into these things. Also sort of thinking about, so one of my groups of students were sort of looking at these isolated spaces and going, okay, well, if you're going into a space, can you potentially bring up an image of a meaningful space that brings a level of sort of peace and sanctity to someone. So, you know, could you see a projection of your garden, of a favorite place that you walk with a loved one, of your kitchen? How could we also think about things like the other sort of senses? So meaningful smells, you know, cooking biscuits, or, you know, burning pizza. You know, how do we actually sort of bring really meaningful sensory experiences through digital technology to people? So through sound, through smell, through visuals and light, and then, you know, how do we actually really personalize these experiences? I think that's a really interesting opportunity going forward.
Another thing we've seen with the mass graves in New York is the importance of having geotags with information in those mass graves, so that people can find their loved one if they're unable to find them. So it's a very practical use of technology when you're having to bury large groups of people, is geolocation tags, which contain enough information that help with people finding their loved ones later on.
There's also been some quite extraordinary examples of, you know, we talked a little bit about bots before, but a bot that you can basically, if you have enough information from voice messages and text messages and recorded voice, that you may actually be able to develop and emulate enough of an online presence of someone that people can have an ongoing sort of relationship or connection, which is a really interesting way to think about what digital connections might mean connected with physical places where, you know, so remains have left, have been left, or places that are of importance to people.
Yeah, great. Thank you. Thank you all. So, ladies and gentlemen, I'm mindful of the fact that we are just over time. I wanted to thank you all for attending. I wanted to particularly thank Emma and Sarah for joining us, and the entire lab team for everything that they have brought to today and the conversations, and also to Venetia Mulani, who is the manager of our Social Innovation Hub, who has really taken the lead on putting together this great intervention. We are back every month. The first Tuesday of every month, we will be doing it again. And so that means the 2nd of June, we will have our next OLO, our next Open Labs Online. And in that session, we're going to be exploring transformations in citizenship that have been brought about by the pandemic, and particularly the rise of the health promoting individual. So we're looking forward to that conversation. We hope to see many of you, or we hope to have many of you with us. In the meantime, we hope that you all stay very well and very safe, and that you enjoy some of the positive aspects of spatial distancing, along with dealing with some of its more complicated aspects. We're sending our warmest wishes to you all, and we look forward to seeing you again soon. Thanks, everybody.